the diagnosis is made, many people have had the disease for 6 to 10 years. That's why finding who's at risk, testing those people, trying to make sure that you detect this disease early is so important.
Of course, many people do experience symptoms without recognizing them. You might need to be tested for diabetes if you feel very tired a lot of the time, have constant thirst or hunger, need to urinate often, experience vision trouble, lose weight for no reason, have frequent infections, suffer from very dry skin or sores that heal slowly, feel tingling or numbness in your hands or feet.
What could I do to improve my diabetes control?
It's so important to ask questions, tell your doctor about how you're feeling, and learn what's going on with your health. Anytime you're going to see the doctor is a good time to communicate. Share information about symptoms or risk factors such as family history, and ask if you should get tested.
So if there's a family history of diabetes, for example, that's a red flag, that's a clue. If the person is feeling tired for no particular reason, and especially if they've started to develop some of those early symptoms like, I'm starting to get up at night more often than I did before to urinate.
That's a familiar symptom to Rosemary. In fact, it's why she was pretty sure she might be diabetic, even before she went to the doctor's office.
I shared that with a friend of mine who is a diabetic. She kind of recommended that I should go and maybe discuss it with my doctor.
You do not have to go to a specialist to find out if you have diabetes. The tests are very straightforward and simple.
The diagnosis of diabetes is made by testing the blood sugar or blood glucose level.
If you're diagnosed with diabetes, you will want to set up a partnership with a healthcare professional or clinic. You'll need regular checkups to make sure your blood sugar levels are under control. And diabetes raises your risk for heart disease, so blood pressure and cholesterol monitoring are important too. Your healthcare team will also check for early signs of problems with vision and circulation. Many of us know someone who has lost eyesight or even parts of their body to diabetes. But that doesn't have to happen. Not if you start taking charge.
So it's not just treatment. It means treating it and reaching the treatment goals that are necessary to prevent the blindness, the amputations, the kidney failure, the neuropathy, the tingling, the burning, the painful sensations, the strokes, and the leading cause of death, the heart attacks. That's why we want people to be in control of it.
Despite those serious consequences, many of us have a difficult time accepting the fact that we have to make some changes.
I was in denial. I thought it was something that I could take a pill and then temporarily and it would be over, not knowing that that was going to become a part of my life.
I have some plastic food models here that we can take a look at.
You do need to take charge of your diabetes to stay healthy, but you don't have to do it alone. A diabetes educator or your doctor or nurse practitioner can help. You'll need to learn how to track your blood sugar, set a weight goal, and develop a plan to be active and make smart food choices. And if medication is prescribed, you'll need to take it as prescribed, even if you're feeling terrific. Let's take a closer look. Chris knows tracking his blood sugar or glucose is one of the keys to staying healthy. His doctor showed him how to use one of the many devices available, so he can check his sugar during and after his overnight shift at work.
I try to do it in the mornings when I get off before I eat my breakfast. And when I wake up, and then when it's time for dinner, I try to get myself another one.
The importance of tracking or monitoring blood glucose or sugar levels on a regular basis is to help in identifying a requirement to adjust the medications, and also to help in identifying when medications are not working properly or a requirement to add additional medicines to keep diabetes controlled.
Even when you feel fine, it's important to monitor your blood sugar daily. Both Chris and Rosemary also go into the doctor's office every 3 months for an A1C test to make sure they're doing all right.
An A1C test is a backup for daily monitoring because it gives an average of what the blood glucose level has been over a 90-day period of time.
Your hemoglobin A1C is at 5.5, which is excellent. It's exactly where we want it to be.
Taking charge of your health also means understanding that your weight matters. To find out whether you're carrying too many pounds for your build, some healthcare professionals advise figuring out a number called your BMI.
BMI is a designation for body mass index. And what we try to do now is to normalize or to express your body weight in a way that doesn't penalize you for being short versus being tall. Basketball players may have lots of weight. These guys weigh 260 pounds, but they're also 6'8". But somebody that's 5'2", and they're carrying 210 pounds, their BMI gives you reason to be concerned.
You can ask your healthcare professional about your BMI or go online to one of many calculators on the internet. A BMI in the 25 to 30 range means you're overweight. Over 30, you're obese. That's a heavy burden to carry.
Obesity may affect many diseases, but starting with diabetes, obesity can cause uncontrolled diabetes or a difficulty to control diabetes because obesity causes greater insulin resistance.
Obesity is probably the most important risk factor in the last 10 to 15 years that we have seen, particularly in the United States. The reason being is that it's just exploding. I mean, the increase over the last 10 years has been 10 to 20%, which is dramatic.
It's time for every family to fight back against this trend. We need to be active, get away from the TV and computer screens, and get moving. If you're a parent, take your cue from Jerry Stackhouse's childhood. Along with his sisters, he had very active brothers.
I was the youngest of 8 boys. You know, I wanted to be like them and be able to do the things that they did and could do. And basketball was what they did, so that's what I wanted to do. And it worked out for me, and I learned a lot from all of them.
You don't have to be a kid or a pro to get going. People of all ages can be active.
I usually try to walk or lift weights, or basically when I go to work, you know, I do a lot of walking.
Even a little bit of exercise is good for everybody, whether it's a full workout or just walking up the stairs to the office. But get a green light from your healthcare team before you get going.
Exercise, or let's say physical activity in diabetes, is an essential component of prevention as well as treatment. We have to make sure, however, that when a person has diabetes, that if you're going to put them on a program of increased physical activity, that it's safe. And in every case, with people who have not exercised in the past, who are going to be starting on an exercise program, you start low and go slow.
For a lot of us, if it's not on the schedule, it's too easy to let it slide. So be sure to make time to make exercise a part of your life. If you think you're too busy to eat right, try Life on Tour with the Blind Boys of Alabama.
Basically, I would say we only go from 150 to 200 days out of the year.
That can be hard on a nutrition plan, but the Blind Boys have learned to ask for traditional foods to be prepared in a healthy way.
They usually have mostly baked food. No. We don't eat too much fried food.